what are some of your experiences? Because you work a lot more with children too. I know
We do,
your practice does.
Most kids and teens.
Tell me about introducing that to children, because I'm used to doing it with teens and adults, but where would you see the differences are maybe with kids and trying to kind of get that point across?
Oh man! So we introduce the OCD monster or the worry monster. There's a lot of what we have them do is we'll have them talk about a bit about what their fears are, and get out some games, get out the crayons, get out the paper, and let's draw a picture. And I might draw a picture of my own worry monster because we all worry, and so I spend a lot of time with kids and teens, people in general, but I think it's really important. I self-disclose a lot more with kids and teens because I think it's like it's really easy to get their buy-in. It's like, oh my gosh, even my therapist is scared of stuff and kind of weird and has his own quirks, and that can be cool, even if it's not.
Yeah, well, but they might like it. It can be
cool. They might like it.
Yeah, they might like it.
You kind of see, but you see, like you will see that just kind of the eyes get kind of wide if you guess something that they're going through. So like,
isn't that fun when you do and they give you that look?
I think you're reading their minds, and it's just like, well, why do you think I can do that? It's because this is a thing that we all experience. I'm not magic. I can't read minds. So I try to normalize it with them a great deal. We talked about the worry monster, drawing that out, giving it a name, a silly name, Scary Gary or Pukey Paul or something like that. Then drawing out the superhero patient, right? So we'll have little Sonia.
Sonia, sure.
Yeah, Sonia. We'll draw Super Sonia, and these are the things that Super Sonia can do to fight back Scary Gary. So we do a lot of getting it down there. We do a lot of little experiments, just asking them when they've ever been afraid of other kind of stuff, meeting new people or trying new food, and then we try to relate that to something that maybe is more in line with what their actual fears are.
That's great. And how about the parent piece of it too? Because I'm thinking you have to get their buy-in.
We do. We absolutely do. So we do a ton of parent training. We actually we strongly recommend at least one parent show up to each and every session and stay for the majority, if not all of it. So it's not classic, drop your kid off, we'll fix them in 55 minutes, and then you get a 5-minute update at the end. Like Patrick and I just said, it's our job to put ourselves out of a job. So in order to do that, how are you going to get an 8-year-old with fears and their frontal lobes, and they're not wanting to do this stuff. So we have to work with parents so that parents know how to do this stuff, so that we can get a reward system together that's really heavy on rewards for complying with treatment, being willing to try things out, teaching parents how to, the things to focus on, the things to not focus on. So family accommodation and reassurance is something that we have to get parents comfortable with, because anxious kids, there tends to be some degree of anxiety in an anxious parent, and this is a lot different than what people normally do as a parent. My daughter's actually here for her 5th birthday. They're downstairs walking around somewhere. Or my wife, not just my daughter.
Otherwise making a call.
Right, yeah. We don't want to do that. But being able to, speak to them in a way that is not so, it's not as comforting. It's more realistic. It's like a you can handle it kind of thing. It's
my favorite phrase.
Yeah. So it's you can do this on your own. Let me help you figure this out. Not, oh sweetie, let me jump in and fix everything for you. We'll take the scary stuff away, or here's a pony or whatever it is. If you just do this, we still focus heavily on the rewards, but we need parents to get the buy-in of you don't have to be there, and it's actually better if you're not there doing the things and walking on eggshells and setting up the mornings so that they don't have to worry about getting triggered. No, we develop a plan for that, and parents have to be on board. One thing about our practice is we actually go into the homes a lot.
Great.
And
that's great.
we actually try to get the OCD going. If we have a kid who tantrums, we try to get a tantrum going so that we can model for parents how we're going to respond. We help them set up the expectations. We help them ignore what they need to ignore, respond to what they need to respond to, and how they need to respond to it. And parents can get really, really good at this. Sometimes we have them come in by themselves. So we'll have like mom and dad come in, and we'll talk about their concerns, because it feels icky. It's hard to see your kids hurt, but doing their compulsions for them or helping with their avoidance is only making the problem stronger over the long run.
Absolutely, and it takes some time to find somebody who really does this.
Yes.
Right.
Oh, gosh.
There's nothing more annoying to me about other therapists than when I go online and I look them up and they say, I specialize in children, adolescents, adults, older adults, divorce mediation, anxiety, depression, bipolar, schizophrenia, and 26 other things.
Pretty much 95% of Psych Today profiles.
Right, which no, you don't. You don't specialize in those many things. It's impossible to specialize in those many things, and it's a lie. And because if you look me up, it's going to say exposure therapy and anxiety disorders, and that's really what it's going to be. And so I would say it's important for anyone to really interview a therapist to make sure that they really do know what they're doing when they treat OCD, and for you as therapists watching to be okay with being interviewed by somebody, because they ought to be interviewing you and be comfortable with knowing that you're the person who's going to treat them. So I'm fine if people ask me tons of questions.
I love it when they do. We handle a lot of the phone calls, my business partner and I, that come in, and it's awesome when you get a parent who is really informed, or somebody who's been doing research, and an adult, and they really want to make sure they get the best deal that they can as far as a therapist, because this, I think we're getting more informed consumers, and they realize that this is not something that you just treat with therapy as usual. You need a specialist, or at least somebody who can be supervised by a specialist. That's something that we do. We do a decent amount of training at because not everybody comes in knowing this stuff. It's a very small amount of us, and we have 6 therapists now, Dr. Zayed and I, and they've come to us with varying levels of experience, but people are very trainable.
Well,
so there's more of that going on.
And there's a lot of thirst out there of therapists who want to learn this too, which is great. So